Starting intro.
And now, we're live. Yes, live from Jay's place. And we're talking
Barbershop Talk.
Yes, barbershop talk, where nothing is off limits and everything's on the table.
Everything's on the table. Barbershop Talk. Everybody. We here at Jay's place. Barbershop. We're talking barbershop talk. Barbershop talk. Barbershop talk. When nothing's off limits. Barbershop Talk. Barbershop talk. Barbershop talk. Barbershop talk. Everything's on the table. Barbershop Talk. Barbershop talk. Barbershop talk. Barbershop talk. Everything's on the table.
5, 4, 3, 2, 1.
Barbershop Talk Live. We're live here at Jay's Place Barbershop, located at 1927 Olive Road. Listen, it's good to see you. I have not seen you since last week, so thank you for tuning in. We're going to have a great show tonight. I feel it. I feel it. This is a conversation we're going to have tonight that you need to be a part of. You need to get engaged with this conversation and listen. Call your friends, call your neighbors, call your church members, call your enemies to tune into this conversation tonight because it's going to be thought-provoking, it's going to be imaginative, it's going to be informative. So I'm telling you, Barbershop Talk Live World, get into this conversation. But before we get to the conversation, let's give a shout out to our people behind the scene that put this program together. What you see, talking to my good friend, talking about Demetrius Johnson, Beverly's Body Butter, right here, homegrown in Augusta, Georgia. The company called Beverly's Body Butter, which is whipped scented shea butter. Whipped scented shea butter specializes in all kind of flavors: peach, mango, tropical paradise, island paradise, and strawberry. Listen, get this product in your hand. Call at 706-564-5335. Again, that number is 706-564-5335. Listen, if you got TikTok, hit on TikTok, which is Melon Queen 1976 again. Demetrius Johnson, right here in Augusta, Georgia, homegrown. Call up again, that number is 706-564-5335. You won't be disappointed. It's good for your skin, it's good for your hair. Some people say it's good for pain. So try it, call up, and get the product in your hand again. Beverly's Body Butter, right here in Augusta, Georgia. Listen, Barbershop Talk Live World again. If you having a problem taking care of it, maintaining it, listen, why don't you call my good friend Alan Odom with that yard work? Call my good friend Alan Odom with the tree work. Call my good friend Alan Odom with your pond maintenance. Call my good friend Alan Odom with your demolition work. The number is 706-294-8493. Again, that number is 706-294-8493. Pond maintenance is also right here in Augusta, Georgia. Specializing in all those areas. You just want to get your grass cut? Call it. You need some tree removal? Call it. You need some demolition work? Call it. You want to take care of your pond or maintain your pond? By all means, call them also. Again, that number is 706-294-8493 in Augusta. Tell him John from Jay's Place Barbershop Talk Live. Say, I heard about you. Hook me up, man. Hook me up, man. Hook me up. Listen, before I be remiss, forget about this particular item coming up in a few weeks. We are dealing with a re-election coming up. Re-election is coming up for the different leaders, the mayor's race, a lot of different areas in the city that's going on, locally, nationally, everywhere. So Barbershop Talk Live World, I just warned you. I urge you. I'm telling you, go out and vote. Exercise your right to vote. Listen, make a difference. Make a difference. Again, Barbershop Talk Live. Listen, I got to get into this conversation because you didn't come to see my pretty face. You didn't come to see my clear white teeth. You come to get into this conversation and see what we're going to talk about tonight. It's going to be informative. Listen, without further ado, I'm going to present to some and to introduce to others, Miss Sherita, Dr. Sherita A. King. How you doing, Miss King? Good to meet you. You doing good? It's good to see you. Man, do you know what it took to get you here in the Barbershop Talk Live hot seat? Do you know? It took almost an act of Congress. And you got the votes to come on in the barbershop. They want to hear about it. They want to know what's going on. But listen, before we get to this conversation, what's going on, I I want to make sure that people know this is a conversation that we all need to know about, whether you're man, woman, young, old, because we're talking about ED.
Yes.
ED, and that's a touchy subject.
Very touchy.
Very touchy. And you know, we here at Barbershop Talk Live World, we like to get into those touchy subjects. We like to get into those conversations that some people don't want to have, but the people want to know.
That they need to.
They need to know.
Absolutely.
They need to know what's going on. So as we said before, Dr. Sherita A. King is in the building.
Yes.
Listen, I'm glad, I'm excited, I'm ready for the conversation, I'm ready for some knowledge, I'm ready for some information, I'm ready to learn about my body. About my body. I thought I knew my body.
Well, you're going to learn today.
I want to learn about my body. So Barbershop Talk Live World again, if you want to know about your body, your husband's body, your uncle's body, your brother's body, anybody's body, get into this conversation. You got a question, you got a comment, you got any kind of concerns, don't hesitate to put the question on the screen because ED is the subject tonight. Some people say erection disorder. We're going to make sure we get into that. We're going to touch on all those subjects and all those conversations. So don't forget, put the questions, put your comments on the screen. We'll make sure all of them get answered.
Yes.
Now, before Dr. King, before we get started this conversation, we want to know about you.
Okay.
We want to know who you are, what's going on with you. In other words, I'm good. As you said off camera, I did my little research. I did my who's who and all that kind of stuff. I check y'all out. So I'm good. But the people that's watching Barbershop Talk Live, they want to know, who are you?
Okay.
So don't tell me. Tell the people that's watching.
So my name is Dr. Sherita King. I am from Augusta pretty much. I've been here since 1989.
Okay.
I went to Evans, all the Evans schools. I'm from Columbia County.
Okay.
After that, I went to the University of Georgia where I ran track. I was All-American in the 100, 200, and in the 4x1.
What?
And then after that, I came back to medical school here at MCG, where I graduated. I did my residency here. I went away for fellowship to San Diego, where I learned more about sexual dysfunction and sexual medicine. And then I came back, and now I'm practicing at Wellstar, MCG, and the VA.
Okay. Okay. That's a lot.
That's a lot.
That's a lot.
Yes, sir.
You've been here since '89.
Off and on, yep.
Okay. Well, that's all right. I would. Now, first of all, I did do some Googling, but I missed that track stuff.
Yes.
I didn't catch that. So Google, we need to work on this Google stuff. But you was a track star.
That I was.
Okay. And the 4x1, what was the race?
So I ran the 100, 200, and 4x1. And I still actually hold, the last time I heard, the record at Evans High School for the 100 meter.
You still hold the record.
Still do. That's a 26-year-old record.
Come on now.
Yep.
All right. That's all right right there. Cool. Now, I wouldn't have never put you in that. I would have. I'd saw you as a cheerleader.
Nah.
Majorette, something like that.
Nah.
And you was a track star.
I was a track star.
All right.
Yep.
All right. Barbershop Talk Live again. We're going to get into this conversation. We're talking to a track star. That is great. So now, fast forward. You graduated from Evans High School.
Yes.
And you went on to San Francisco, San Diego?
No, I went from Evans to UGA.
Okay.
And that's where I ran track. Came back to med school here, did my residency here.
Okay.
Then went to San Diego
Okay.
for my fellowship.
Okay. All right. So in other words, you've been around the world.
I've been around.
Got to be more careful. So now here's a question, Mr. Dr. King. I want to start off right now. We want to just jump into it.
Okay.
As see, you know, as a barbershop, a lot of conversation comes in the barbershop.
Absolutely.
So when the guys heard that you was coming onto the show, here's the question arose. You mean to tell me she went to school to study penises?
Yes.
She went to school to learn
Well,
about
I mean,
sex?
I learned a lot more. And as a urologist, I can do any surgeries on the genital or urinary tract of men, women, and kids.
Okay.
But I chose to specialize in erectile dysfunction.
So that's the specialty.
That's my specialty.
Okay. How many years you been doing that?
Ooh, I started practicing in 2016, so it's coming on 10 years.
10 years. So you specialize in the erectile dysfunction side of it.
Yes, erectile dysfunction. I also look at Peyronie's disease, which is curvature of the penis. I also do hormone management, especially in men, so men with low testosterone. I also will do stress urinary incontinence in men. So that's if you leak urine, that's typically after prostate cancer, but we'll talk about that another day.
Okay.
Yeah, so those are my main focus.
Cool. This is gonna be a great conversation because you talking about some stuff I would have never imagined when you talking about the curvature of the penis. Okay, well let's get into what caused the curvature of the penis.
So curvature of the penis, it happens when you have a trauma or injury to the penis, and then So the inside of your penis, you have 2 erectile chambers. They're covered with this tissue called tunica albuginea. It's sort of like gristle of chicken. It's very strong. And that's what holds all that blood in when you get an erection. So what can happen is you can have an injury or a tear to that tissue, and you bleed into the surrounding tissues. When the blood gets into that tunica, it causes a plaque or like a scab. And then as that scab forms, instead of your penis being straight with the erection, it bends towards that scab.
So do you want the penis to go straight up or curve?
So now some patients or people will just have a gentle, normal curve, okay? And that's fine. It's when it becomes so bent that you can't actually penetrate, or you have pain with penetration, or your partner has pain with penetration, that's when it becomes an issue.
Okay.
A little curve doesn't hurt anybody. A lot of curve is a problem.
So now you say a little curve, you mean like a...
Like 10 degrees.
10 degrees curve is good?
Yeah, that's okay.
Okay, so what if the we just talking now.
Yeah.
What if the penis hooks to the right or hooks to the left?
That's okay.
That's good too.
Yep, as long as it's not so curved that you can't actually penetrate or it's causing pain for you or your partner.
Okay. All right, so when you say some type of injury, is that's a blunt injury to the private area?
So it could either be during intercourse, so you can have what we call a penile fracture. So that's when you're having intercourse, you're trying to penetrate, either you miss or the penis bends with penetration. And when that happens, you cause a large tear within the tunica albuginea. And that's when you get what we call eggplant deformity. So the penis will blow up and look like an eggplant because so much blood is coming out through those erectile chambers.
Now, Dr. King, when you say doing penetration, so that means you actually doing some thrusting power.
Yes, that's typically how it happens. Now, there are some patients who will say they have had injury with catheters, injury with just like external, not even having intercourse, like getting hit. I've had patients who had like nocturnal or nighttime erections and rolled over on their penis and caused a fracture or injury. So there's a lot of different ways that it can happen. I've had patients do things to themselves with self-stimulation that can cause injury also. So it just depends. There's a lot of different ways that it can be injured, but yeah. So then you get the curvature, and then that's when you come see me.
So now, here go. I just found out that I know your mom.
Yes.
You never know who you know, right?
That's right. Small world. That's right.
World. So now, by me knowing your mom, and I know how your mom is, how did your mom take it when you told your mom, I'm gonna worry about we're gonna look at some penises, I'm gonna study the penis, I'm gonna worry how it works, what it don't do, but how did that conversation go?
So anybody that knows my mom knows that she is a big cheerleader for anyone, anybody with their goals. And she is my biggest cheerleader. So my whole family is. They all will come support. Like if I'm doing a community talk, they're in the crowd just typically. They tell people about what I do. They drum up more support, get more patients to come to see me. With my parents, the age that they are, that's my demographic. Those are people I want to see. So they're sending their friends to me. So they are my biggest support system.
Barbershop Talk Live again. Get into this conversation about ED. Erectile dysfunction. If you have a problem, anybody you don't have a problem, please, man, please, sir, put your question on the screen, put your comments on the screen. We will make sure you understand what's going on. So listen, Barbershop Talk Live, Ms. King is in the building, Dr. King is in the building, giving us information on ED. When you say ED, we also talking about erectile dysfunction.
Yes.
We're also talking about the curvatures. We're talking about the ups, the sides, and all that kind of stuff. Is anything we can take for that? When I say take as a pill to do that, get it back to the right.
Yeah, so for erectile dysfunction, yes, there's lots of pills. For Peyronie's disease, there's no pills. Then we can talk about that a little bit later, because that's a totally separate subject. But for erectile dysfunction, the first thing that I feel like people have to understand is what's the actual definition of erectile dysfunction, because I can't tell you how many patients will come in and say, oh no, I don't have any issues with erections, and then when I start talking to them, they are like, oh, well, I guess I do have erectile dysfunction. So erectile dysfunction can be any of the things, whether you can't achieve an erection at all, where you can't maintain the erection, or you're not able to get a full erection in order to have intercourse.
Okay, so let me ask you this question, Doctor. What if when you say the full erection, what is considered a full erection? When a full erection is considered hard.
Completely rigid, yes.
Complete your heart.
So when I'm talking to patients, I always want to figure out like how rigid or how hard their penis is.
Okay.
And there's a couple different ways. In our office, I don't bring it out anymore because it's kind of ancient.
Okay.
We have like a little model that patients can feel on to see, so they can gauge like, okay, am I this hard, or this hard?
Okay.
If I'm just talking to a patient, I'll tell them 100% is fully rigid. I'm usually have a pen in my hand. I'll be like this pen, it won't bend at all.
Okay.
That's 100%. 50% means you get some fullness, but it's not standing up on its own. And I ask them to grade themselves between that 50 to 100%.
Okay.
Or you can do it on a 10-point scale, or you can do it on a 4-point scale. Whatever is easiest for my patient to be able to understand what I'm asking.
So here's another crazy question, because again, we just want to know. I just want to know because some of this stuff is new to me. So if you have a penis that's not rigid and it's not completely hard, can you still ejaculate?
Yes. So that's another thing. You have to be able to understand that there is a difference between erections, ejaculation, and orgasm. Those are 3 separate things. They all work together.
I thought that was...
They all work together, but they're very separate things. So erection is the hardness of the penis.
Okay.
Okay. Ejaculation is when you have the semen that squirts out.
Okay.
Okay. But an orgasm is the sensation you get at the completion of intercourse.
Wait a minute now. So when I...
And you can have a disorder in any of those things. So you can have ejaculation and a good erection, but you don't have the orgasm. Or you can have an orgasm, but not be able to ejaculate or have an erection. So it can be different things that are going on there.
Doc, you don't mess me up now. I thought the ejaculation is when the semen comes out.
That's what I said, yeah.
But the orgasm, you might not have an orgasm.
You may not have an orgasm with it.
Now,
You may not have like the fireworks, the crescendo, the top end of it. But stuff comes out, yes.
So if it's still the semen coming out, that is not the orgasm.
No, the orgasm is the feeling that you have. Yes.
So let me ask you. So now, are you saying that sometimes people fake the feeling?
Yes. Unfortunately.
Barbershop Talk Live. Well, listen, we talking about some things. Are you faking the feeling? Are you having an orgasm? Are you having the Barbershop Talk Live again? I'm good, but the people want to know.
Yes.
I thought ejaculation, orgasms, and all that go hand in hand.
They go in together, but the issue is that it's not necessarily the same thing.
Okay, that's new on me.
Yep.
I thought when I ejaculate, that's my orgasm.
They happen at the same time typically, but it's not the exact same thing.
Okay, so is the ED hereditary?
Erectile dysfunction itself isn't hereditary. It's more of the chronic diseases that can lead to erectile dysfunction. So that would be like your hypertension, your diabetes, your heart disease. When I see patients who come in for erectile dysfunction and they don't have a primary care physician, then I am going to send you to see someone because this is the canary in the coal mine.
Okay.
Okay. So you remember they used to take canaries down in the coal mine? If the canary dies, everybody's getting the heck out of there?
Right.
Okay.
Okay.
So if you're having erectile dysfunction, it's the first marker for any problems that's going on in your blood vessels.
Okay.
And the reason why you see it in the penis first is because the penile arteries are a lot smaller than that of your heart, your kidneys, and everywhere else where you can have issues, even going towards your brain.
Okay.
So since it's a smaller artery, a smaller amount of plaque or damage to the blood vessel is going to be more pronounced than in other places.
So I'm trying to visualize this, Doc, because I guess if I look at a person or a guy, we're talking about the guys, and I see a lot of veins, and that's to me was a signal of good blood flow.
Not necessarily. Not necessarily.
Okay.
Yeah. Yes, you like having good veins and being able to see them is a good thing.
Okay.
That doesn't necessarily mean they don't have any endovascular trauma or problems or disease going on.
Okay. So again, that is my visual. If I see this guy is full of veins and popping everywhere, I'm assuming he got good blood flow everywhere.
Not necessarily.
And what would cause the blood flow not to go in the private areas?
So what happens, and it's to any of the arteries, you start to have blockages within the arteries, and that can happen from either having high cholesterol, so you get plaques that kind of form. You can have trauma, barotrauma. So like if your blood pressure is high, it causes trauma to the blood vessel walls, and that can cause issues. So those are the two main things. The other thing is diabetes. So diabetes is a silent killer. It wreaks havoc everywhere,
Right.
And it can also cause issues with the blood vessels and the tissues within the penis.
Okay, so now what we do on Barbershop Talk Live, we always go back to the chat line and see who's watching. Who we got? We got Rudy Collins, ATL Dream Vision. He said he's just checking in. Gerald checking in. Well, we got Gerald Wilson. He's checking in. Talking about he's at Rudy House. Roger Prince said he's working on it. So we just want to give out some shots of all the folks that's watching Barbershop Talk, just tuning in. We also live here on TikTok. We got some folks watching on TikTok. We want to make sure everybody get a chance to have some comments, ask some questions, ask some concerns, because again, ED is the conversation, erectile dysfunction. Again, if you watching Barbershop Talk Live, you got any questions, you got any comments, you want to comment on maybe your situation, anything that you might be dealing with, Dr. King is here to address those concerns, address those questions, anything concerning your body. Please, man, please sure know about your health. That's what we're here for, to give you the information that can make yourself better and make your partner better.
Yes.
That's right.
Absolutely.
So now here's a question that I think some of the people want to know. If I'm having erectile dysfunction, remember I said anybody, we're just not talking about me. If we're having this erectile dysfunction, why are men not really taking care of it and going and getting themselves checked? What's the stigma behind that?
Yeah, so I find it goes one or two ways. Either this is going to bring them in.
Okay.
Like they can be like, oh, I've been having chest pain for like weeks, years, or whatever.
Right.
But as soon as their penis stops working, they're coming to see me.
Right.
Or on the flip side, I have patients who are very embarrassed.
Okay.
Because men feel like if they can't get an erection, they're less than a man.
I get you.
So that's the main barrier that I see for patients. But once they get over that, then we can help them out and treat them.
So how many of the guys are actually embarrassed? When I say embarrassed, they come in there, they see you in there, and I got to pull my pants down. You got to put on the gloves and do all that. How many guys do you really know that are embarrassed, you know?
A lot of them are. And then the fact that I grew up in this community, a lot of people will come in there and be like, oh, I didn't realize it was going to be you. And I'd be like, yeah, you should have, like, do your research before you go to the doctor. But I think it's important I try to talk to patients on their level.
Okay.
And I really try to like disarm them with a little bit of humor. We laugh about things. I try to make them comfortable.
Okay.
So they feel like they're able to open up. And I actually have a lot of patients at the end of the visit be like, I didn't expect to be able to tell you all the things that I told you today.
Okay. So now, Doc, I'm going to go back to my childhood. Can I go back to my childhood?
Absolutely.
Going back to my childhood, little kid growing up, and every guy probably experiences when they wake up with an erection. Mm-hmm. Is that normal for little kids wake up with an erection? What is that? Tell the people at Barbershop Talk Live world that is normal.
That is normal. And it's important because that's going to help keep the tissues happy and healthy, okay? So having those spontaneous nocturnal erections or spontaneous AM erections, morning erections, that is actually nature's way of keeping the tissues happy and healthy. So it is a normal thing. And that's actually the first thing that you'll see go when erectile dysfunction starts to creep its head.
Wait a minute. You're not waking up in the morning with erection, that's the sign?
That's one of the signs.
That's a sign that erectile dysfunction is coming.
It may be coming, yep.
Okay, so now are we referring to our diet that can play a part in this?
Yeah, so a lot of things can play into it. Diet, exercise. The main thing, though, is once the damage is done, okay, your penis is like, listen,
Wait a minute.
I tell patients all the time, I bring out a piece of paper.
All right, go tell
and
it.
I crumble it up, and I'm like, I can unfold this paper, but it's never going to be the way it used to be. So once you do the damage to your body, it's the damage is already done. Not to say that we shouldn't improve and do better with our meals and with our exercise, because doing better will help us to be able to improve or prevent further worsening.
Okay.
Right? But it's not going to change what we've already done to ourselves.
So are you telling the people at Barbershop Talk Live world when the penis is in the ED stages, there's no reversing?
No, we don't have that technology yet. And most of medicine, honestly, is not. We should focus more on preventive medicine because then we prevent people from getting to this point. But once we get there, there's not a lot of things out there that can reverse and turn back the hands of time to fix things.
So if I have ED, you telling me I can't reverse it? I'm stuck with it.
Yes, but we have plenty of treatment options. plenty of treatment.
So normally, what's the normal age that we start experiencing the ED?
Yes. So I would say the most common age that patients start to see issues is around like their late 40s, 50s, going into their 50s.
Okay.
I call it the rule of ages. So if you're looking at 100 men that are 50 years old, 50% of them will have erectile dysfunction.
Okay.
When you get to 60, it's 60% of men. When you get to 70, it's 70% of men. And it goes on as the ages go up.
So a 35-year-old guy like me, I'm good.
Yes.
Okay, so I got a few more years.
You're okay for now. As long as you're taking care of yourself.
Barbershop Talk Live. Listen, I'm good. She said I'm good. I'm taking care of myself. So are you still talking about the exercising? Is there a certain exercise we need to do as we get older for as men?
Yeah. So you want to focus on a aerobic activity. Okay. I have to get on to a lot of people, including my father. He loves to play golf. I'd be like, listen, golf doesn't count.
Okay.
Leisurely walking from hole to hole does not count as an aerobic activity.
That's not okay.
When we're talking aerobic activity, I'm talking about having your heart rate at a certain level for at least 30 minutes and a couple days a week.
Okay. All right, let's go back to the chat. Is there such a what is it? Rob Prince said, is there such a thing as blue balls? Blue balls.
Yes.
That's old school now.
Yes.
Okay.
So what happens is that's when you have congestion in the testicle and also the epididymis, which is tubes that are kind of on the outside of the testicle. When you have sexual arousal, but then you don't have the emission of the semen, because that's where the sperm and everything come from, the testicle. So that's why you get that congestion and that pressure in there. So yes, it's a thing. No, it's not an excuse to try to pressure people into doing what you want them to do.
Barbershop Talk Live, do you have blue balls?
I hope not.
I hope you don't have blue balls again. This is a conversation I urge you to get in contact with, because we are talking with Dr. King, specializes, a urologist right here in the city, specializes in erectile dysfunction, studying of the penis.
Yes.
The urethra. No, not the, well,
I do a little stuff in urethra.
Okay.
That's a topic for another day.
I got you. So let me ask this question now, Doc. We want to get a little more deeper to this conversation when we're talking about the different the erectile dysfunctions, and as you say, there's nothing that can reverse it.
Mm-hmm. Yes.
So if there's a guy that's thinking he can do something to arouse himself up, what if he want to masturbate?
Okay.
Is masturbating some kind of way to arouse the penis back up?
I mean, it'll help you get a sexual arousal.
Okay.
But if you have erectile dysfunction, you may not get that erection, but you can still have an orgasm.
Wait a minute now.
Yeah, because remember we talked about it, right?
Okay.
Erection, orgasm, ejaculation, they're all separate. They usually happen at the same time, but you can have one without the other. Because I have patients who have severe erectile dysfunction, but they're still able to self-stimulate. I typically say self-stimulate because masturbation carries like a negative connotation in culture. So with self-stimulation, you're still able to climax. You're still able to have that orgasm.
Okay.
However, you may not reach an erection.
Okay.
And that's okay, because if you're not trying to penetrate, then you don't need an erection. And that's another thing that I try to get patients to understand is what are their goals for their sexual health and their life style. So if they are not trying to have penetrative intercourse, then we don't have to work as hard to get an erection. Not saying that they don't have to try to get one, but if they don't want to penetrate, then you don't have to have an erection for that.
So what else to do if you don't want to penetrate? The name of the game is to penetrate.
Yeah, there's a lot of different things you could do.
Okay, the people want to know, what else can you do if you don't penetrate?
Well, it depends on your partner.
Okay.
It depends on what you want to do with yourself. There's plenty of things you can do at self-stimulation.
Okay.
There's a lot of stores around this area that you can go to if you want to get toys for sexual play. But it just depends on what the patient actually wants.
Okay. Barbershop Talk Live World, what do you want? You want to get self-stimulated? You want to penetrate? The doctor said to answer those questions, that she would make sure that you understand how your body works.
That's right.
What to make it work for your partner. So, Doc, let me ask this question. When we're talking about ED, is it almost maybe the man's fault or the woman's fault?
It's So that is a huge problem that I see in my practice, where patients or their partners kind of it's a tug of war, like whose fault is it, right? So the partner may feel like, oh, I'm the issue, they're not attracted to me.
Right.
But when you do that, it makes it worse on the patient, because then they're internalizing that, and it makes them feel worse. So a component that I use a lot in my practice is sexual therapy.
Okay.
So I have these patients go see a therapist, but they specialize in therapy that kind of wraps around like sexual issues. So like
Okay.
erectile dysfunction,
Okay.
intimacy issues, sometimes couples type therapy. And that helps out a lot because
Okay.
your mind is very powerful.
Okay.
So it doesn't matter what treatments I'm giving a patient.
Okay.
If they are so psyched out, they're so anxious, they're like so wound up,
Right,
they're
right.
not going to be able to get that erection. And that's part of evolution, right?
Okay.
So when you're that anxious and you're that wound up, you're tapping into your fight or flight response.
Mm-hmm.
When we were all cavemen, right, and women, if you were having sex in the middle of a pasture and a saber-toothed tiger come running out that woods, right?
Right.
You want that erection to go down
Right.
so you can get out of
Get
there.
out of
So
there,
the
right.
blood will go to your legs.
Right.
It don't need to be in your penis now, it needs to be in
Right.
your legs so you can get out of there. So what happens when you tap into that fight or flight, you're doing the same thing.
Okay.
You are countering all the things that are supposed to happen to help you get an erection. So it's very important that you're in a good frame of mind, that you're not having a lot of stress, you're not anxious, and that you don't have like issues with depression. So there's
Okay.
different treatments that we can do to help tailor to that too.
So if the woman feel that maybe she's the fault that the guy won't get an erection, how can she help him also? Because again, the guys say, well, if you're not here, I'm all right.
Yeah.
But if you stressing me out.
Well, no, so that's more like situational erectile dysfunction.
Okay.
So if you have ED like across the board, right, then that's like true. There's probably something organic going on within the blood flow issues. If it's something that's more situational, where if you're self-stimulating, you get a great erection. However, when you're with certain partners and you don't get an erection, that's more situational. And that's more of a mental aspect of it.
Okay,
And we have
okay.
to try to work to figure that out.
Okay. So in other words, that could be coming from counseling. You might have to get the counsel with those couples.
Yep.
Okay, I got you. Barbershop Talk Live again. We are talking about erectile dysfunction. We talked about earlier about the penis curving,
Yes.
straight,
Yep.
hook to the left, hook to the right,
Yep.
or just sitting up.
Just standing up.
Listen, we're gonna take a quick commercial break. You mind if I take a commercial break? Pay this bill.
perfect.
I got to pay a bill.
Yeah, go for it.
Barbershop Talk Live. Listen, we're going to pay a bill. We'll be back in a few minutes talking with Dr. King, specializes in erectile dysfunction. If you got any questions, do not hesitate to put those questions on the screen. We'll make sure we answer all those questions. Listen, we got the people that's on TikTok, watching us live on TikTok, watch us live on Facebook and also YouTube. Get into this conversation about erectile dysfunction, ED. You might have a question. We want to answer it. Dude, listen, be back in a few minutes. My good friend, Mr. Edward Wright, Wright One Well Body Work. He's here to let you know what he does for your body and also for your health. Watch the commercial. We'll be back in 2 minutes. Barbershop Talk Live. We are back live. That's my good friend, Mr. Edward Wright, Right One Wellness Bodywork. Listen, follow what he's doing. Get in contact with what he's got going on. Maybe he has something for your body and your mind also. That's Barbershop Talk Live in the building. Dr. King.
Yes.
I just got through paying the bill. And I just learned some stuff before we went to pay the bill. And you have enlightened me on some stuff. And I know you're enlightening the people at Barbershop Talk Live World because they are excited what you got to tell them. Now, here's a question I want to get this out because they told me to ask this question.
Okay.
Now, you ready for this question?
I guess.
All right. The question is, does size matter? That's old school. You see this all over the place, and people say size matter. The women say if he ain't big enough, he ain't satisfying me. Man, I don't want that little bit of thing.
Listen.
So Barbershop Talk Live want to know, does size matter?
Okay, so as far as size goes, it just depends on the partner that you have. Okay, not everybody wants to have a very large penis.
Okay.
Not everybody wants a smaller penis.
Okay.
There's somebody for everyone.
I got you.
So does size matter? It just depends on your partner.
Depending on your
honestly.
partner.
Yep.
Okay. All right. Now, Roger, we go back to the screen where Roger Prince is saying, he says, so stress can play a big part.
Absolutely, it can.
It can play a big part in erectile dysfunction.
Yep, because when you're anxious and you're stressed out, you're going to counter all of the things that your body's trying to do to get that erection.
Okay. So going back to what we said earlier about the foods and the exercise, because some people might have didn't see the first part of the show when we talk about the different foods. Now, when you saying foods, are you talking about pork, steak, chicken, any type of certain foods we need to be eating?
Like if you think about heart-healthy diets,
okay,
right? So it's like your Mediterranean diet. So
okay,
it's not so much of you can't eat a lot of things. Like the way we prepare stuff in our culture is not the best,
okay,
right?
Okay.
But if you eat a good balanced diet, more like on the Mediterranean side with a lot of vegetables,
okay,
leafy green vegetables. Try to limit your red meat. Some people can tolerate it. Some people can't. Like
okay,
I know if I eat red meat all the time, my cholesterol will be through the roof, right?
Okay.
So you have to modify based off of what your health is.
So what is the age of a male that they're not getting the erection? I mean, if he not talking about ED, not talking about any kind of illness with his body. So if he's healthy throughout, what age though can we still expect that particular guy to keep getting erection? Is it in his 70s, 80s, 90s?
I have patients that see me and they are still able to get erections in their 70s and 80s. So it just depends.
No medicine.
No medicine.
Okay.
It's not a lot of them, but
okay,
I do have some.
Okay.
And I see them for other reasons.
Okay.
But there are those patients out there, and some of it is genetics. Some of it is just how they took care of themselves throughout their lifestyle.
Okay. So now, Dr. King, I got to ask the question. Now, when you looking at these guys, do you have to actually touch these guys to make sure they hard? Because this visible.
No, I do an exam on patients.
Okay.
Yeah.
Okay. So there's a feeling.
Yes.
Okay.
Yeah.
I just want to know that, and the people want to know because it's not all visible.
Yeah. No. I mean, like we do exams on patients. It's like if you want to get into talking about like how we work it up and like our like medications that we give patients, we can go through that, and then I can talk about how.
Let's do that. Barbershop Talk. Let's do that.
Okay. So if you come to see me and you're saying, "Hey, Dr. King, I have erectile dysfunction," then what I'm going to figure out is how long it's been going on. Is it in all situations?
Okay.
Are you diabetic? Do you have hypertension?
Okay.
What medications you're on? Because a lot of medications can cause issues. And that could be like your blood pressure medicines can do that. Not telling you not to take them.
Okay.
But I'm just saying it can cause issues, just so we're on the same page. Also, some antidepressants can cause problems with erections and sexual arousal. And then I also want to know if you're having issues with like fatigue, because that can clue me into you having issues with your hormone levels. So like is your libido or your sex drive intact? So we look at all those things. Okay. So that's just us talking.
Okay.
If you have not tried anything and you're coming to see me just fresh off the boat, never done anything, the first thing we're going to do are pills. Okay. So that's your Cialises, your Viagras, your Levitra. The newest kid on the block is Stendra.
Okay.
Those medicines work by increasing blood flow into the penis.
Okay.
Most of these medicines you have to take at least an hour before intercourse.
Okay.
And the thing that a lot of people don't tell you is you have to be stimulated for it to work. Okay, they're not magic beans.
Oh, okay.
You're not going to take
You
it
don't
and
just pop
magically from
Okay.
a stock. It don't work like that.
Okay.
So either you have to be touching you or your partners have to be touching you to get the erection going.
Okay.
You still need that sexual response and that sexual contact. And then if the pills aren't, and let me back up. So if you're taking sildenafil or Viagra, that has to be taken on an empty stomach.
Okay.
Okay.
All right.
Levitra also. Those have to be taken on an empty stomach. If you don't, you're wasting your time.
It don't work.
It ain't gonna work.
Okay. I didn't know that.
Okay.
I didn't know that.
It's very important. A lot of people don't tell patients that because some physicians don't forget. They forget about it, or they may not know. So it's important that you understand how to take the medications. So once pills stop working, then the next step is injection therapy. And I know that sounds, yes.
Injection therapy.
Yes.
All
That's
right.
where you actually take a needle and you're going to put it into your penis every time you want to have intercourse.
Wait a minute now, Doc. You saying you're gonna take a needle and put it into the head or to the
It's going to be on the side.
on the side?
Yes, sir.
Okay.
Yeah.
And that'll get direction.
Yes, because the medicine that you're going to inject is very similar to the medicines you take by mouth, but we're putting it directly at the site where we want it to work. So so some reasons why patients don't stay with the pills is they have like side effects. So
Okay.
patients will complain of congestion, they'll have headaches, they'll have vision changes where their vision turns like bluish green, especially with sildenafil, or they can have like low backaches. And that's because you're taking medicine by mouth and it's going all over your body. So your body's reacting to that medicine everywhere.
Okay.
When you do the injections, you're doing the injections straight into the penis, so you don't have all those systemic side effects.
Okay.
And the other thing is it's going to work faster because you don't have to wait for your body to break it down to
Right.
send it everywhere. So that
Okay.
one, it takes like, if it's going to work for you, it's going to work within minutes.
Okay. Okay. Barbershop Talk Live Real again. We're gonna go back to the comments. We got another comment coming from Roderick Prince. He says, "What can we do at home to prevent ED and have a better erection?"
Okay. So, like I said, what's done is done, unfortunately. But going forward, again, you want to have healthy diet and good exercise activity. So you want to be able to get out there, have aerobic exercise, and eat healthy. Those are the best things you can do for yourself. Because
Okay.
anything so if you just think about things that are heart healthy, it's going to be penis healthy. Because it's the same thing. Heart needs blood flow, penis needs blood flow.
So can we also go back to some of the natural herbs?
So the thing with the herbs is there's not a lot of research out there, so it's hard for me to say, oh yes, this herb is going to do great for this.
Okay.
Like there's a lot of anecdotal evidence of people just saying like, oh, if I took this is what happened for me.
Right.
But there aren't any large studies like they have with the medication, so it's hard for me to completely back behind some of these.
Well, I told you.
herbals.
I told
Yeah.
you.
Okay,
You ought to
that's
believe
great.
me. I told you the herb
I'm so happy it works for you.
it's good for me.
Yeah, great.
But that ain't the clinical study.
I can't tell everybody else, well, John said that it works great. Yeah.
That ain't gonna work.
No,
All
that's
right. So now when we talking about this particular injection, that got to be uncomfortable.
It's not as bad as you think.
Okay.
Okay, so I just had this conversation with a patient today. He came in, he was like, ain't no way I'm gonna do this injection. I was
Right.
like, listen, just have an open mind and let's just try it out. Because it's a very small needle. It's like an insulin needle.
Okay.
So it's very, very small.
Okay.
Once you get past the skin, you really don't feel much.
Okay.
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 But it is a hurdle for patients to get over, definitely.
So is there any kind of injections or medicine to make the penis larger? This growth that some of the guys really want.
Yeah. So there are newer things out there. They're called just like people get fillers in their face, you can get fillers in your penis.
Okay.
It's not, well, I think some of them are now FDA approved, but the issue with them is that it's usually going to be cash pay. You're going to have to pay out of pocket, and it's going to be expensive.
Oh.
Yeah.
Okay. All right. Barbershop Talk Live World again. We are talking about the penis dysfunction, erectile dysfunction. We are talking about the different pills, the different medicines, and injections.
Yes.
She said, well, you can't. Now, remember, if you have the erectile dysfunction, it's permanent, but there are
treatments.
there
for
are
it.
treatments for it.
Yes.
Now, one of the treatments that I think we want to talk about, Dr. King, is you said earlier about the pumps,
Yes. Like, you mean like the penile implant or the vacuum erection device?
the penile implant.
Okay.
So we're talking about implants.
Yes.
So are we implanting something into the penis?
Yes.
To make the penis have a steady erection?
Yes.
Okay, now tell the people at Barbershop Talk Live World how did that works.
Okay. Well,
We have some samples here.
Yes.
We actually got it here. So let's tell the people.
I brought some samples in.
Okay.
Okay. So the way they work, if you think of the penis as a bike tire.
Okay.
Okay. So you know a bike tire has an inner tube.
Right.
So your erectile chambers are your inner tube.
Okay.
So when you're not having great erections, then we basically replace your inner tube, or we put this inside.
Wait a minute. So now, what I see all these different, things here. So this actually goes into the guy's private area.
Yes.
So are we implanting this inside the penis, inside the testicles? How are we doing this now?
All right. So there's a couple of different components. So
Okay.
there are different implants out there. These two are the main ones that I use. They're inflatable. They're a 3-piece. Okay.
Okay.
So when I say 3-piece, that means there's cylinders, a pump, and then a reservoir.
A reservoir.
Okay.
Okay.
So the cylinders are your new inner tubes for your penis.
Okay.
Okay. The pump goes down into the scrotum, so the testicles have a new neighbor.
Okay.
And then this reservoir goes in your abdomen or in your pelvis to hold the water that's going to fill the implant up.
Oh, so in other words, they're not having a orgasm.
No, they still can have
They
orgasm.
still have an orgasm.
Yes. This is for people who can't get erections and where injections do not work.
So this part is into the stomach area,
Yes.
and so they kind of mash the stomach like that and pump it up.
No, they're going to use the pump that's down in the scrotum to pump it up. This is just a reservoir. This just holds the fluid.
Water.
Yes.
Okay.
Saline.
And this is where.
This is where you interact with it to pump it up.
So now we have 3 testicles.
Yeah, but you don't push on the other 2 because you'll know about it. Make sure you squeeze in the right one.
Okay.
So the way it works, the way that I do the surgery, I do a small incision. It's about like 3 to 5 centimeters, depending on the size of the patient.
Okay.
Just above the penis. So all of this goes in through an incision just about this big.
All of this goes inside the penis area, the penis area.
All of this goes inside of my incision that's this big. It's going to be right above the penis. So where your pubic bone is,
Right.
So between your pubic bone and your penis, that's where I'm doing the incision.
Okay. All right. Now what is this one here behind you?
They're very similar. It's just 2 different companies.
Okay.
Yep. So
So-
they both have the cylinders that go in the penis. They both have a pump that's down in the scrotum, and they both will have a reservoir that sits up in the abdomen.
So this also can increase the size.
No.
It can't increase the size.
No.
So whatever size this is, that's what size the penis is.
Yes. So we measure the penis
Okay.
when we're in surgery. So once we gain access into the erectile chamber, then we do a measurement on the inside, because your penis is not just what you see on the outside. You have an internal portion.
Okay.
Okay. So we measure the total length of your penis. I'll tell my rep who's bringing the implant in, hey, so-and-so is size 20 centimeters. And then they'll pull out that implant, and that's what I put in.
Oh, so each implant depends on the man's penis size.
Yep. It's
Okay.
very customizable.
Okay. All right. So as you said earlier, size does matter.
Size does matter.
Okay. All right. Barbershop Talk Live World again. Size does matter. It does matter.
I mean, it depends on, like I said, just find the right partner for you.
Let me go back to the implant. So we have
Yes.
two tubes here,
Yes.
and both tubes goes inside the penis.
Yes. These tubes go into the penis. This pump is down in the scrotum, and then this reservoir is in the abdomen. And everything is completely concealed. You wouldn't even see it. Nobody would know. Just looking at you, nobody would have a clue that you had an implant.
Okay. So there's no discomfort once it's in there.
So it is a surgery, right?
Okay.
So when I do my surgery, I do a nerve block. So a lot of my patients don't have as much pain. So for about the first 2 weeks, I tell patients, you're going to know I've been down there. Okay. But after that, most people are back to their daily activities.
Okay.
There's a 6-week total healing period
Okay.
where you can't have intercourse, no soaking in tub baths, no swimming, no hot tubs, stuff like that. But after that, I release everybody back to the wild and tell them to have fun.
All right. So how long does this erection stay? Once this pump is in, it's constantly erected.
No. So these are inflated right now, okay?
Oh, they are. That's an inflation now.
Yeah.
Okay.
You see they're full, all right? And the thing about the implant is you can climax, orgasm, and keep going.
Oh.
Because the erection is going to stay up until you push the button to let it down.
So wait a minute now, Doc. So you telling me once we pump it up to the full hardness,
It'll stay up until you let it down, which is a gift and a curse, because I do have patients who will pump it up and then forget how to let it down, and they'll leave it up for days. When you leave it up for days, it'll put a pressure sore on the end of your penis, and it'll wear it down. So you see how it's soft now and flaccid?
Right.
So that way it's concealable, and all the fluid is now up here in this reservoir.
Okay, so once we pump it up and we have the orgasm, when you say orgasm, you will secrete the semen.
If you still have a prostate. But again, we're going to talk about that.
If you have a prostate. Okay,
Yeah.
so everything matters.
Yeah.
You got to have the prostate. And once you finish with the orgasm, you release the pump.
Yes.
And then it goes back down.
Yes. And then you deflate it. You put a little pressure on there, and the fluid goes back into the reservoir. Because you see now the cylinders are compressible.
Okay.
Where before they were full.
Okay. Now, does this work as also in any situation? When I say any situation, we talking about oral sex.
Yes.
It's still working the oral sex.
Yes. You pump it up, and it's going to get erect.
Okay.
It's like Reebok pump up, but in your penis.
In the penis. Barbershop Talk Live World again. We are talking about the pumps, the penis pumps. You don't got me off track. I didn't know what to expect.
You told me to bring pops.
You brought the trap. You brought the props. You brought it to us, and that's what we want to know. We'll make sure you know what's going on with your body, with your health. Doc, let me ask this question. Mm-hmm. Once this is in your body, how long do we need this in our body?
So this is a mechanical device, okay? So just like our TV, our cars, our cell phones, none of these things last forever, right? So typically, the lifespan of an implant that's quoted is about 10 years, okay? However, we have seen them last longer than that.
Okay.
It's better for a company to say it'll last 10 years and you get 20 years out of it and you're happy, rather than they be like, it'll last forever and you get 10 years, you're like, what in the heck, right?
Okay.
So under promise, over deliver. But if it malfunctions, then we'll replace the device.
Okay.
Okay? But you can leave it in as long as you want. The only reason why I usually typically will take these out is if patients have chronic pain from them, or if they get an infection after the surgery. Those are the two main reasons. But those are very rare to happen.
What causes the testosterone level to decrease in men?
Okay, so we're switching gears. So testosterone levels, it's just like women, right? So as women go through menopause, men go through menopause, okay?
Okay.
So your body doesn't function the way it did when it was 18.
Okay.
Right? You're not going to expect your testicles to make the same amount of testosterone. Now, do I have older patients who have great levels of testosterone? Yes.
Okay.
But that's not everyone.
Okay.
So it's part of aging. Some of it can be from if you're using anabolic steroids.
Okay.
Okay, that can cause an issue. Sometimes stress, not taking care of yourself again, being overweight. All these things can be linked to lowering your testosterone.
Is that going back to the blood pressure?
Blood pressure is not as related.
Okay.
Yeah.
So, well, as again you said earlier about the diabetes. So being a diabetic, overweight, not getting the proper exercise, that can lower your testosterone.
Diabetes itself, not as much, but there are studies that are showing that testosterone is important for your metabolic health.
Okay.
So like making sure that you're not insulin resistant, and that's what's usually happening in type 2 diabetes.
Okay. So the regular vitamins, the B12s, the iron, the zinc, those are good, for testosterone.
They're good for your overall health, but it's not going to make your testosterone level go up.
Barbershop Talk Live again. I am learning something new each and every time we open our mouths and ask the question, because again, I want to know about my body. As I reach around 36 years old, I'm getting to be 36. I want to know how I would be coming when I turn 37. I want to know. And the people need to know. Listen, let's go back to the chat line. We got Roger Prince says, is this up on the warranty? Is this some type of warranty issue? Because when you having these problems, thing going on, ain't acting right, is this certified?
So, yes, there are warranties on the implant. So if yours malfunctions, typically it is going to be covered.
Okay.
Yeah, and especially if it's a defect in the implant itself. But again, that doesn't happen very often.
So most of this coverage is insurance coverage.
Yes.
Okay.
Yes.
So 90% is up under some type of insurance.
Yes.
Okay.
Now, patients can do self-pay.
Okay.
Because I do have patients who either their insurance will say is excluded completely because they feel like it's a cosmetic procedure, and no matter how much I've appealed to them, they usually will just say no. You can do a self-pay option, but
Okay.
it is expensive.
Okay.
And you just have to make sure it's something you really understand and understand how much you're putting yourself on the hook for.
Okay. So Doc, when a guy hears something from a woman, and it's always the meaning is hard to hear. When a woman tell the guy he ain't but a 2-minute man, we ain't lasting no time. I'm gonna get me somebody. What you doing? You can't give me what I want. So is that one of the reasons, besides these pumps and the guy take these pills and all that, your self-esteem is low, you want to perform, you can't perform, you know, and that's why I asked the question earlier, is it the man or is the woman? Because the woman can say some stuff so bad that the guy can't even get up no more.
Yeah, so that, remember, we talked about that, it's more like stressors.
Okay.
Things that are being put onto the patient. But not being able to last for a long time, that's what we call premature ejaculation.
Premature ejaculation.
Okay?
Okay.
So with premature ejaculation, the technical term or definition is if you penetrate and have an ejaculation within a minute of penetration. Okay?
Okay.
So, but if you really look at like all the people who are having issues with that, I'm not going to tell a patient who lasts 5 minutes that you don't have premature ejaculation. It's still premature
Okay.
for them, right?
Okay.
So yes, we have our scientific definition, but we treat more than that.
Okay.
That is an issue with the sexual response, okay?
Okay.
So typically when you start to have excitation, you go into what we call a plateau phase, okay? So if you're
Okay.
looking at the sexual response, it looks sort of like a little bell curve, kind of.
Okay.
And then but you'll have like a little plateau phase. But people who have premature ejaculation, instead of going to that plateau phase, they go straight up into orgasm.
Okay.
So you can't do the foreplay. You can't be able to last longer. So what we have to do is try to figure out a way to break that
Okay.
sexual response so we
Okay.
can prolong that plateau phase. And the way we do that typically is either like a lidocaine jelly.
Okay.
The main one on the market is Promescent. You can buy it online. The thing with, and it's over the counter. The thing with Promescent though is if it numbs you, it's going to numb your partner.
Oh.
So we typically tell patients to make sure they wear a condom with that one. And the other things that you can try are some antidepressants.
Okay.
So it's a group of them called SSRIs or serotonin blockers, basically.
Okay.
So, serotonin reuptake inhibitors. So it prevents
Okay.
the reuptake of serotonin. So we're increasing serotonin in your system.
Okay.
When you increase serotonin, you dampen the sexual response.
Okay.
Okay? So when we do that, it allows them to be able to last longer. But this is something they have to take every day.
Every day.
Yeah, this is not an on-demand type medication like the Viagra's or the Cialis. This is something you have to take every day.
So is there a average time frame? You know, when the guy's having intercourse, you know, like we said earlier about the 2-minute man. Is there an average time that you want to be able to perform?
So if I'm treating a patient for erectile dysfunction, what I tell them my goal for them is somewhere between 15 to 60 minutes. Okay.
50 to 60.
15.
15.
1-5.
1-5.
15
Okay.
to
All right.
60 minutes.
Okay.
And it just depends on you, your partner, your expectations, your health overall.
Okay.
Right? So not everybody can be a marathon runner, right?
Okay, okay.
So it just depends on your health and what your expectations are.
So a good 15 minutes is a good average time. Okay. All right. Look, I'm learning as I go. Barbershop Talk Live World again. 15 minutes. 15 minutes is the average time. That's the normal average time.
No, I'm not saying it's the average time, but that's the goal.
That's the goal.
That's the goal, to get between 15 to 60 minutes.
Okay. All right. Are you working up toward that time? Please, ma'am, please, sir. Be honest with yourself. Dr. King said at least average 15 minutes. I think we can do that without the pump.
Well, it depends.
It depends.
It depends on what your function is.
Okay. Now, how can the people reach you? How can they get in contact with you if they're having these kind of disorders and different functions? How can they reach you and maybe you be able to help those persons out?
So, like I said, I practice at WellStar MCG. Our clinic number there is 706-721-7000. Again, 706-721-7000. When you call that number, I think it's option 3 and then option 3 again, but you have to listen to it 'cause sometimes they change the options on us.
Okay.
Basically, you're listening out for my name for my clinic.
Okay.
And once you do that, you can get into our clinic and leave a message. Or if you call the main number for WellStar, you can go to the scheduling bank and then somebody can get you on my schedule. But I will warn you, I am part-time there, so the wait can be long, but it is worth the wait. And if you're a veteran, then you can have your primary care physician at the VA send a consult to urology. I am only in the clinic on Wednesdays, okay? So if they put you in the urology clinic and you want to see me, make sure they put you on a Wednesday.
On a Wednesday,
because otherwise
okay.
you may see somebody else. And yeah, so you can just tell them to put my name, Sherita King, in the consult that you want to see me.
Okay.
And those are the two best ways to get in touch.
How often should a guy have sex?
That's up to them. There's no rule book out
There's
there.
no rule book.
There's no rule book.
Okay.
Yeah.
So now that if a guy have sex more than 2 times a day, is that harmful or helpful?
It depends. If you're doing it 2 times a day, every day, that can be stressing on your system and even stressing on your partner.
Okay.
So you just have to kind of pay attention to your body and your partner and
Okay.
see what's best.
I listened to, Wilt Chamberlain, 20,000 women over his lifetime. We got to believe him because that's what he said. So when I hear that number, I'm like, boy, he was a man. 20,000?
That doesn't make you a man.
Well, I mean, in the barbershop world, that's, you talk.
Okay.
But I'm just saying, that's what I wanted to know. Is there a certain amount of time that a guy could have sex throughout the day?
So there is something. So remember we talked about the sexual response, right?
Okay.
And the sexual cycle. So just like when you go through the plateau, you orgasm. So for men, you end up going into this resolution, okay?
Okay.
So that's a period of time where you can't get an erection again.
Okay.
And that changes over your lifespan, and it differs from person to person. Some people can go back quickly. Some people have a longer refractory period.
Okay.
So it just depends on you and what your refractory period is to the number of times you can go in a day.
Okay. I didn't know. Barbershop Talk Live World again. We are talking with Ms. Dr. King. Erectile dysfunction. Please, man, please, sir, get your chance. Put them questions on the screen. We'll make sure to answer all those questions. Put your concerns on the screen. Make sure we answer all those concerns. Any disagreement, anything you want to know about your partner penis or your penis. That's what we're here for. Penis is this topic of this discussion tonight. I want to know. You shouldn't be able to know. Again, as you said earlier, Doc, exercise regularly. 30 minutes of high impact workout.
It doesn't have to be high impact. It can be low. It can just be a long walk. Okay? But
Okay.
you just want 30 minutes of aerobic exercise.
Now, aerobic, again, is that considered basketball?
Yes, as long as you're moving. Now, if you're just sitting there on the sideline, that doesn't count.
Okay. So as long as you're moving.
As long as you're moving.
Okay. Barbershop Talk Live World again. Every Wednesday you on call.
No, every Wednesday I'm in clinic at the VA.
You in clinic at the VA?
Yes, my clinic at MCG is on Mondays.
Okay.
And then on Tuesdays I'm in the OR and Thursdays I'm in the OR.
Okay. All right. So what's the reason behind most of the black guys dealing with the erectile dysfunction? Because I see that's a main area that most of the blacks are dealing with. Is it just more of that diet, or is it, like I said earlier, is it hereditary? Is it generational? Why we see more and more black guys than anything else?
Well, I mean, in my practice, I do see a wide breadth of races in there. So I wouldn't say it's just black guys, but what I would say in our community is our diet is not always the best. Okay. So we aren't taking care of ourselves. We do eat a lot of fried foods, heavy meals, a lot of sugars. So all of those things are not good for our system overall. So it's not just injuring your penis. You're injuring everything else in your body too.
Okay. I like the way you put that, injury your penis. That's a good way to put it.
Yeah.
So again, we still going back to the diet.
Yes, diet. And then the other thing is smoking. Smoking is terrible too.
So smoking has a effect on the penis.
Yes. Because smoking is going to cause vasoconstriction, and you want vasodilation. So you want the blood vessels to open up, to be able to get the blood into the penis. And it's also causing damage to the blood vessels.
And as you said earlier, once the penis is damaged, when you say damage, you're talking about the blood vessels.
Yes.
Well,
the blood vessels or even the tissue, the erectile tissue. Once that's damaged, we don't have anything to reverse that. But it's the same thing, like if you have a heart attack, I don't have anything to reverse your heart attack. What we have to do is go in and either put stents in to open up those arteries or harvest veins or get grafts and make new connections for your heart to get blood, right?
Right.
There's no fixing the vessels. We're not at that stage yet in medicine.
So is this considered to be a stent in the penis?
No, I wouldn't call it a stent.
Because you open up the blood vessels, right?
No, this is just, okay, so the erectile chambers are like spongy tissue, okay? So it's like muscle.
Okay.
So when you get an erection, or when you get excited, the blood vessels in that chamber will dilate.
Okay.
Then blood percolates into that, or spreads out into that spongy tissue. Once it gets into that spongy tissue, that tissue expands. So you know, like those little sponge toys you give kids, and they throw it in the bathtub, and then it sprouts out, and it has a big dinosaur.
Right.
So that's kind of what the inside of your penis is like. It's like that sponge. Once the blood goes in there, it starts to expand. As it expands, it's going to cut off veins that are on the outside of that tissue by pushing up against that tunica albuginea that we talked about earlier.
Okay.
Okay. So when you compress those veins, then that's when you're able to sustain that erection. Okay. So when you damage the tissue with inside of there, you start to get what we call fibrosis or scar tissue. So that tissue's not as expandable. So then you don't get the full erection like you used to. So it's not just the blood vessels, but it's also the tissue within the penis.
Okay. All right. It's different because when I started talking about you going into this particular practice, it's something I would never think of, get into. So you've been doing it how many years now?
Almost 10.
10 years? A urologist for 10 years?
Yes.
Okay. Barbershop Talk Live. We got a urologist live in the barbershop letting you know about your penis, your erectile dysfunction, get it corrected, and again, diet and exercise is the main thing. So
That's preventative.
that's preventative. So as you said earlier, if you eat right early at an early age, and you have some patients that are getting into their later years and they're still getting erections, and that's come from taking care of your body, eating right at an early age.
Absolutely.
All right. Again, how can they get in contact with you? How can they follow you?
Again, you're going to call at 706-721-7000. That's for the WellStart MCG urology office. Or if you're a VA patient, have your primary care doctor put in a consult to urology and just have my name in the tagline.
Barbershop Talk Live. Well, listen, I enjoyed the conversation. If you didn't have a good time listening to this conversation, we did.
I did.
I enjoyed it because, again, I learned a lot. I don't know if I want to get I think I'm okay with it.
If it comes down to it, that's to tell patients, like, I can get you to an erection. It's just how far you're willing to go. I'm not going to hog tie you and make you get it.
Right.
But if you want to have penetrative intercourse and there's nothing else, this is what we got.
That's the last stop.
Yep.
Nobody can look at a person and know if they have this in their body.
Nope. Everything is contained.
Okay. All right. And this is the pump that pumps all this up.
That's the pump.
That pumps everything, and this the water is. So in other, the pump is filled by water.
Saline, yes. So it's like salt water.
Salt water. Okay. I enjoyed the conversation. I listened. Come back for part 2. We'll get more in depth with it, dealing with the prostate.
Yes.
Stuff like that.
Yes, because we can talk about prostate cancer, which is a huge issue in the Black community.
Right.
And an issue that I have found is why I'm also passionate in this is that patients are scared to get prostate cancer treatment because they're scared of the erectile dysfunction that they'll have and the incontinence or leaking urine that they'll have afterwards. So that's why I go and talk about these things at prostate cancer events, so that way they know there is hope, right?
Okay.
So, like, yeah, you may have problems, but I can fix it.
So is that considered to be your frequent urination?
No. But, so frequent urination could be from your bladder or your prostate.
Okay.
But when we're talking about prostate cancer, I'm talking about like actual cancer cells within the prostate.
Okay.
And it's more prevalent in the Black men. So it's something we need to talk about.
We need to talk about it. Barbershop Talk Live. We're going to get it back into that conversation later. I hope you had a good time watching this conversation because, again, if you're dealing with erectile dysfunction on any level, any age, anybody that you know about it, get in contact with my good friend, Dr. King. She will make sure you understand how it can be treated.
Yes.
Not reversed.
Not reversed, but treated.
It can be treated.
Yes, sir.
Barbershop Talk Live again. We had a good time talking with it. We hope you enjoyed the conversation. Had the chance to get all your questions answered. If we didn't, stay tuned to part 2. We're going to come back with part 2 at a later date, talking about your prostate.
Yes.
What you need to know about your prostate, how to treat your prostate. It can be a longer life.
Yes.
That's correct?
That's good.
Again, we're elated. We're excited that Doc had a chance to come in, sit in the hot seat. Educational. Educational. Again, listen, can I give away something?
Yeah.
I got to give away something. You don't mind if I give away some stuff?
Go for it.
Barbershop Talk Live. Listen, if you pay attention to this conversation, if you listen to this conversation, I'm going to give you a gift card, courtesy of Little Caesars, and also a blood pressure monitor.
That's very good.
A blood pressure monitor, courtesy of Piedmont Hospital right here in Augusta, Georgia. Listen, 3 questions. We're going to give out 3 simple questions. If you get these 3 questions correctly, these gifts belong to you. The first question is always a simple question. The first question is very simple. The first question is, how long has she been in Augusta? What year did she come to Augusta? You said it, didn't you?
I did.
You did it. I heard you say it. Barbershop Talk Live again. The first question is, what year did she come to Augusta, Georgia? That was back in, don't say it.
Okay.
Don't say it. That's the first question. The second question might be a little tricky. The second question is, where did she run track at? You said
Are you
it.
talking about high school or college?
College.
Okay.
You said it.
Yeah, I did.
You said it.
Yep.
She's a track and got some records still standing. She said it. Listen, you paid to this conversation. Here's the gifts. First question is, how long, what year did she come to Augusta? The second question is, where did she run track in college at? You said it.
Yeah, I did.
And some records are still standing.
Yeah, well, the records are still standing at Evans.
In high school.
Yes,
Right.
but I think it's on the leaderboard or the top 5 for some of the stuff.
Yeah.
I didn't say it.
You didn't say it. You cut it short. Now the third question is very simple. I know everybody know the third question. Just tell me what hospital she works at now. That's simple.
And there's 2.
Yeah. Just tell me what she at, and listen, you get those questions correct. I need one person to give me all 3 answers. Put the question on the screen. Here's your prizes. Stop by Jay's Place Barbershop, 1927 Olive Road. Get your prizes. Listen, we got some more. Did anybody else get the question correctly? We're gonna go back and watch the screen later and see who got those questions correctly. But for now, erectile dysfunction is very important. Erectile dysfunction, listen, you might be a curver. You might be a straighter. You might be a hooker. You might be a right or lefter. But get your penis checked out.
That's right.
Now,
Because
again,
it is a marker of your overall health. That's the most important thing there.
wait a minute now. So depending on how your penis sits.
No. Your health, like if you're able to get an erection.
Okay.
Remember we talked about it.
Okay.
Because it's the blood flow.
Right.
Right? So if your blood flow is bad to your penis, it's going to be bad to your heart. It's going to be bad to your brain eventually. So
Okay.
we want to look into that.
Okay. God bless you. God, Bob. Listen, I had a good time talking with this conversation. So Barbershop Talk Live World. Next week on the hot seat. Next week in this very hot seat, none other than my good friend, Mr. Bobby Bands. Be right here in the hot seat talking about the event he got coming up on June the 6th. So Barbershop Talk Live World, please, man, please, sir, keep watching. Giving us some ideas, giving us some topics we're going to talk about. If you want to be a guest on Barbershop Talk Live, just inbox me. We'll make sure we get that done here. If you want to be a sponsor of Barbershop Talk Live, do the same thing by inbox me. We got a sponsorship package for you. We'll promote your product, your event, or your service. Again, my name is John Milton. This is
Dr. King.
Barbershop Talk Live. Again, we're looking forward to seeing you each and every Wednesday right here on Facebook. We're on YouTube, and also now we're on TikTok. So follow us on TikTok, subscribe, and like and share. We'll be back in next week in this very hot seat. None other than my good friend, Miss King, is in the building.
Yes.
Know her mom. I just realized I know her. Anything you want to tell the people before we get out of here?
No, just take care of yourself, and hopefully everybody learned something today.
I think they did. At least I did.
Yep.
At least I really did. Now, do you see that camera?
Yes.
Do what I do. Follow me. Ready?
Okay.
See you later.
Bye.